Hello, my name is Katrina Myers, and I'm doing a discussion on bipolar disorder, and this is for the Advanced Abnormal Psychology class. Bipolar disorder originated from the ancient Greeks. It comes from the word melancholy, which means black and chloe, and mania, which is derived from menios, which means spirit, force, passion, and came from the Indo-Europeans. The relationship of melancholy can be traced back to the ancient Greeks. In 1854, Jules Ballinger and Jean-Pierre Faure presented descriptions of the disorder to the Académie de Médecine in Paris. In the early 1900s, the German psychiatrist Emil Kraepelin studied the natural course of the disorder. Kraepelin incorporated many notions that have been endured still today. In 1950, Carl Leonard coined the term bipolar. People with bipolar disorder describe their life as an emotional roller coaster. They have the extreme highs, which they have everything is sunny, everything is happy, everything is wonderful, they are talking excessive, their thoughts are racing, and you really can't make sense of what they're saying. It's just like go, 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 go. The extreme, and they have euphoric joy. The lows of bipolar disorder, you would see depression, despair, they sleep all the time, they see no reason for doing anything, and they have a low level of serotonin in their brain. The DSM-5 distinguishes two kinds of bipolar, bipolar 1 and bipolar 2. In bipolar 1, they have full manic and major depressive episodes. Bipolar 2 episodes alternate with major depressive episodes and hypomanic episodes. Bipolar disorder is a major public health problem with diagnosis often occurring years after onset. The U.S. is ranked higher in every category of bipolar disorder, and that shows onset between the ages of 18 and 44. The diagnosis of bipolar disorder is quite extensive. Bipolar patients can be similar to other mood and psychotic disorders such as schizophrenia, depression, and schizoaffective disorder. The therapist should assess for the presence of psychotic features, cognitive impairment, risk of suicide, and risk of violence to others. Some other things or the reason it's kind of hard to see if a patient or a person does have bipolar is they also resemble somebody that has ADHD, especially when they're in the euphoric joy and the high stage of their issue. A lot of ADHD patients are extremely high energy and just go, 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 go. So you kind of get confused. Are they bipolar or are they just ADHD? So you really have to do an extensive treatment analysis. You really have to do background checks. You have to do family checks. You have to do work checks. You really need to get a whole full circle round before you just assume that they have that, because there are so many other things that fit the realm and it's in. And it looks like, just like mood disorders or depression or schizophrenia. The therapist should assess for the presence of psychotic features and cognitive impairment, risk of suicide, and risk of violence to others. Sometimes they can be a big risk to others, especially if they're sad and depressed and they see no reason for living or any of that. And they can be a big risk of suicide for them, just like Robin Williams just went through. Accurate assessments depend on information from several sources. Patients also require ongoing education regarding their illness, the treatment options, and the impact of the disease. Once you diagnose your patient and they realize that they have bipolar, you really need to explain what their life is going to be like, what they can do, how they can live with this disease, and give them all the options and really sit down with them and listen to them and let them present what they think about it, and you present what you know about it. For effective treatment of bipolar disorder, many mood stabilizers such as lithium and medications are helpful. Usually the medications require at least 1 to 4 weeks to see the full effects. And again, if some of the effects that are known to be associated with lithium are weight gain, cognitive problems, tremors, low sex drive, sadness, and if you need to explain to your patient that if any of these occur, you need to immediately call your physician and call your therapist, because we need to get the dosage balanced out, and we need to know when it's happening, how it's happening, and we can fix the problem for them. They don't have to live this way. They don't have to live. They're already suffering because they have the disease and they're in constant chaos, but they don't have to feel like the medicine is also keeping them in constant chaos. Some of the long-lasting effects of bipolar are it can affect the person's ability for employment, relationships, schools, or social settings. The reason it affects their employment is because if you're in an extreme high and you're happy all the time and you're just talking and rambling on, and yes, at times when they're on that extreme high, they get lots of work done. And then the next time you're extreme low and you won't even get out of bed to come to work. So it's a real struggle for bipolar patients to keep and maintain a job. And employers are kind of leery of hiring people with bipolar because they know of all the highs and lows that go with it. So it's very hard for employers and for them to keep employment. It's very hard for schools in a school setting, because if you're a teenager with bipolar disease, you're considered weird when you are doing all these emotions and talking all crazy, or you're sad all the time and all you care about is going to sleep. I mean, that it's just not normal for a teenager to act like that, and their friends don't want to be around them. Family members, it's very hard for them because they never know what to expect. It's one day they're happy, and then by the next week they'll never get out of bed, they'll never feed the kids, they'll never show up for Christmas gatherings. It's just, you just never know when the shoe is going to drop. Family members take on a great burden when dealing with bipolar patients, because usually family members see the first symptoms, and they're the ones that will tell the family member, hey, I believe you got something going on. I think you need to go see a psychiatrist. I think you need to go see a doctor. And usually they're in denial. They don't want to admit that they have something wrong with them. But family members carry that burden of, hey, there's something going on, there's something wrong. They also carry the burden of taking care of them, making sure that they take care of themselves, taking care of their family members, making sure they take their medications. If they're not employed, they give them money, they take care of them financially. It's a big burden for a family member and friends of a bipolar patient. If you're dealing with a bipolar patient, sometimes they can become violent and non-responsive, and it requires a great deal of patience and empathy and support. They want to know that there is hope. They want to know that they have support. It's a long process. Medications do help and work, but sometimes the first set of medications won't work, and they have to go through another process, and it's a long process to get the balance of the right medications and the right therapy and getting them to commit to that, because a lot of them, they want to commit to it, but then they want to party and they want to have a normal social life. Well, they can't. It's very strict. It's a strict regimen of keeping yourself alcohol and drug free, maintaining your schedule of medications, maintaining your schedule of treatment and therapy, and it kind of drives the bipolar patient, well, why I can't be normal, I don't feel normal, and they can slip off the deep end, and once they slip off, then you have to get them back on track of medications and therapy, and it's a very long process and a slow process. It requires a great deal of patience and empathy on the therapist, on the family members, on the friends, on employers, and on the therapist. The therapist really has to invest the time and the energy and want to help that patient get better and want to help that patient find the right medication strategy and make sure that they're on the right path to getting better. And it is manageable if the patient is willing to work hard and follow all the protocol of the medications and the therapy. I want to thank you and good luck.